The very end of the day. I know I'm between you and your dinner, so I will try not to take too long. Thank you, Julio, for inviting me to be amongst all of these amazing people. I'm really humbled by the panel here, as well as so many people that I've met over the course of the 2 days that we've been here. My head is spinning with so much information. I think I had a sense earlier today of what I would say, and then, of course, so much information came in, and I have just so many different thoughts. As both Ed and Louise mentioned, we're embarking on a new project in Swaziland, which is really exciting, and we mentioned a lot of the more formal partners, and some of you may not know it, but you're all now involved in the project, because I now know what I can learn from all of you, so I'm going to take you back to Swaziland with me, at least in terms of your contact information, because I think there's a lot to learn. I'm going to take this opportunity to really focus a bit on what I've taken away from the day in terms of approach and process and some of the characteristics that I've heard in terms of different themes. I think we've heard great examples over the course of the day of a variety of different ways of approaching treatment as prevention and different approaches to it. So I want to kind of tap into that and also try to relate it a little bit to the project in Swaziland, because it's certainly influencing how I'm thinking about all of it over the course of the meeting. As Louise talked about, the project is in a variety of components. So amongst many important efforts already going on in Swaziland, we're working with the government and partners to try to achieve universal access to treatment at current guidelines more quickly, see if we can get there soon and target some of the remaining barriers. And I think this session really, for me, gave me a lot to think about in terms of how we approach that and how we evaluate it. And certainly there'll be those evaluation aspects within our own project, but I think I have a lot to take away from what everyone's come up with today and thinking about it in terms of implementation science, certainly, as well as the other approaches we've heard about. The third part of the project as well is if we are able to think about and prove that there is an impact on prevention in terms of the first component of the project, then I think we have to then go to the next phase in terms of asking questions and what do we actually need to do to be able to go at each phase of the project. And we've talked about health systems, we've talked about impact on people living with HIV, we've talked about a variety of different aspects. So I think there were a variety of different approaches we talked about today. Even within implementation science, we learned that it included monitoring and evaluation, operations research, impact evaluation. I think the framework that was established in this session was very helpful. I think we also learned that it can be applied to a lot of different topics and lots of different settings, and that implementation science is not the only approach, but we learned a lot about different clinical trials and what have you. And I think we need to understand over the course of this meeting how the puzzle all fits together, and I think this session really helped us start to do that. I liked all the different cascades of the day, and I think another one that started to evolve here was that we were going to translate evidence into policy, and I would take that then policy into implementation again, and then it becomes a cycle, I think. So just touching on some of the characteristics that I heard come out as themes over this session in particular, but also the course of the day, just so that we can go away thinking about a variety of these aspects as we come into tomorrow's discussions. I think we learned today that that all of these situations are very complex, and that each individual group has a variety of important characteristics that are unique to them. So as we're thinking about treatment as prevention, we need to keep that in mind. I think there was an emphasis on the fact that the processes are very dynamic, and the way that we're looking at this problem needs to be dynamic. I liked the emphasis, particularly that Nancy had on definitions today. I think definitions are very appropriate. We have to define the approach, and we had implementation science defined a bit better here. We have to define our cascades that we're really looking at. We have to define our objectives. So something that was very compelling for me was the discussion over the course of the day about saving lives and making sure that we think about treatment for the individual, but also treatment for public health as well. Definitions of what the barriers are as well, to make sure that as we're asking the research questions that we're ensuring that we really are targeting the key barriers that are there. I think throughout the day as well, we heard a lot about efficacy and effectiveness, but also about feasibility and acceptability. And those are things I think we need to keep in mind throughout all of the approaches. We also talked about harmonization, and I think we talked about harmonization in particular in relation to data, but I also heard a lot about harmonization of different approaches. I certainly think there needs to be harmonization within Swaziland as we're bringing this project there, but also integration of all of these different approaches. Evaluation was certainly a theme, and it's evaluation in a variety of phases in a variety of ways. And we have to evaluate based on what the real needs are. So I think about, for example, for our project, that we need to evaluate the different initiatives within our effort to achieve universal access at current guidelines. And then as we take it to the next level, we need to evaluate the scalability, the feasibility, and also the new questions about what it will actually take and what the new considerations are if we then change the threshold at which we put patients on treatment. We need to know when to jump off, and I think we've pushed it there quite a bit today. I think Stephen Lewis gave us a lot to think about yesterday. We've heard that we need to have some proof, but then we have to move and make it happen. And I think if we combine all the different approaches we've talked about, and I think implementation science really helps us start to bridge that gap, that we can then jump in and really make sure that we're evaluating, but we're also moving forward. I really liked Sharon-Ann's emphasis on focusing on the patient. I think that was really important, and I hope we can take that away today as well. I think pragmatism as well, as in terms of the focus on the patient, but being practical and realistic about what's possible. So coming from the tiny country of Swaziland, I can tell you there are lots of challenges, and thinking about how we're going to really implement this on the ground is difficult. And I liked that, Nancy, you talked about the fact that there's a possibility for course correction, because I think that's going to be really important as we leave here and think about how we implement treatment as prevention. And I also like the idea of let's do it so it does work, and the need for adaptation so that we can put things into place and really make sure that we can actually put them so that things are operating as we think about projects like MSF's project. I also think that from the evidence-based activities, we've talked about the possibility of prioritization, which we've heard today is going to be really important with funding constraints as well. And I think funding is not a reason not to do it, but it does help us really prioritize how we will accomplish it. There was also a theme of exploring new options, and I would really push us to be bold as we do that. I think we've talked about dreaming today. Certainly, we're calling ourselves the Dream Family over in Swaziland, implementing the Dream Fund. So I think we need to really explore and push ourselves to be bold. We touched on a variety of different groups today and learned that there are a lot of different ways to think about treatment as prevention. And I think it's exciting that we all have an opportunity to think about how each effort contributes to the larger goal. And so I think this meeting is a great opportunity to do that. And so I'm really excited to kind of be new to this group, but thinking about treatment as prevention. So thank you.
Thank you, Alison.